Hi, my name is Dr. Antonio Webb. I'm an orthopedic spine surgeon here in San Antonio, Texas. As a spine surgeon, I see and treat patients who have problems, degenerative problems, deformity, trauma with their neck or low back. So how much do spine surgeons make? This is a very convoluted and difficult question to answer. It varies by practice type, whether you're academic spine surgeon or an employed spine surgeon or in private practice. But in general, a private practice spine surgeon in the South can expect to make, once you build a mature practice, which takes anywhere between 3 to 6 years to build, can expect to make 7 figures. My hottest medical take about the field of spine surgery is that people always ask, why do they call it back surgery? They call it back surgery because patients, they just keep coming back. It's one of those things in spine surgery that is, it's a downside of the field. When we do surgery on patients who have degenerative issues and deformities, pathology of their spine that requires a fusion, well, that next level above that fusion and the next level below that fusion will break down at some point. Most of our studies show that patients will have what's called adjacent segment disease about 3% per year. So in 10 years, there's a 33 or 30% chance that that next level will need additional surgery. Also, patients that come to my office, they have multi-levels that are affected. So they have disc degeneration disease or stenosis at like 4 or 5 levels. We try to do what's called symptom-specific surgery. We try to address a specific symptom and address that at that time. But as patients get older, that next level is going to break down, and that may require surgery as well. So that's why they call it back surgery. Patients just keep coming back. If I wasn't a spine surgeon, I would probably do something in real estate. I have a passion for real estate and buying residential properties and hopefully commercial properties in the future. I love going to look at properties and just buying a property and renting it out or rehabbing it and reselling it. So that's always been a kind of a passion for mine. That's something that I do as a hobby. And if I wasn't a spine surgeon, I would be a real estate investor. The least favorite part of my job as a spine surgeon is dealing with insurance companies. When I have a patient who comes to my office, they have severe compression of their spinal canal, and sometimes they may have weakness or some radicular complaints, and the insurance denies their surgery because they haven't done 6 weeks of physical therapy. Well, that is the least favorite, and it's the most frustrating. Having to deal with insurance companies and they tell me which implants that I can use in surgery, which levels of the spine that I can address either with a fusion or a decompression, and whether or not I can just be able to operate on the patient. And very frustrating. That's my least favorite. And you know, it's one of those things that does take a lot of time for appeals, for getting on the phone with the insurance companies, for peer-to-peer, for denials. Very frustrating. Least favorite part about being a spine surgeon.